maxillary central incisor has incisal edges which, along with the proximal surfaces, form incisal angles. The tooth is the widest mesial-distally on the crown and has a great curvature of the CEJ. The roots are conical in shape and come to a blunted apex. The mesial contact is in the incisal 1/3, and the distal contact is at the junction of the middle and incisal 1/3. Distinguishing right and left can be accomplished by observing the incisal angles. The mesial incisal angle is usually sharper, and the distal incisal angle is usually rounder. On these models, one can also observe the imbrication lines in the cervical 1/3, as well as the developmental depressions, which separate the 3 developmental lobes on the labial. From the lingual, one can also see the curvature of the CEJ. There's a cingulum, as well as mesial and distal marginal ridges. There's a lingual ridge and lingual fossa. From the proximal view, the overall crown outline is triangular in shape. The incisal edge is centered over the long axis of the tooth. The height of contour for both the labial and the lingual is in the cervical 1/3. From the incisal, one can see that the proximals taper towards the cingulum. The maxillary lateral incisor is similar to a smaller maxillary central incisor. However, it also has the greatest crown variation. There are incisal edges and incisal angles. The mesial contact is in the incisal 1/3. The distal contact is either in the middle 1/3 or at the junction of the middle and incisal 1/3. Distinguishing right from left, the mesial incisal angle tends to be sharper, and the distal incisal angle tends to be rounder. It is single-rooted, and you may see imbrication lines on the facial surface. From the lingual view, there's a centered cingulum, distal and mesial marginal ridges, and a lingual fossa. From the proximal view, the profile of the crown is triangular, and the height of contour for both the lingual and the labial is in the cervical 1/3. From the incisal view, the lateral is more rounded and less triangular than the central incisor. The maxillary canine has an incisal edge that comes to a cusp tip. The mesial cusp slope is shorter than the distal cusp slope. There can be imbrication lines on the facial. The distal contact is in the middle 1/3. The mesial contact is at the junction of the incisal and middle 1/3s. The distal outline can be quite convex in the contact area, and then there's a depression between the contact and the CEJ. There's a prominent labial ridge. From the lingual view, there are mesial and distal marginal ridges, a cingulum, and a fossa. This is the longest tooth in the whole dentition. On the proximal, The labial height of contour is in the cervical 1/3. The lingual height of contour is in the middle third. The incisal outline is more asymmetrical. The mesial on the right here, the labial is more rounded, and the labial on the distal is more concave. In general, maxillary premolars have a buccal ridge with adjacent buccal developmental depressions. The first premolar has 2 roots. The second premolar has 1 root. The maxillary first premolar is larger than the second premolar. The crown is centered over the root. The crown is also wider in the buccal lingual direction than in the mesial distal direction. There are 2 cusps of approximately equal size. This is the maxillary first premolar. The mesial and distal contacts are just cervical to the junction of the occlusal and middle thirds. The buccal cusp is slightly distal to the long axis. Therefore, the mesial cusp slope is slightly longer than the distal cusp slope. From the lingual cusp is slightly offset to the mesial. The lingual cusp is also slightly shorter than the buccal cusp. On the proximal view, the mesial marginal ridge may have a marginal groove or spillway. There's also a distinct depression on the mesial root. The general outline from the occlusal view is a hexagon shape. There's a prominent buccal ridge, a central groove with few supplemental grooves, mesial and distal pits. Mesial and distal converge towards the lingual, and there are triangular fossa. The facial of the maxillary second premolar, the buccal cusp is not as long or as sharp as the first premolar. Mesial and distal contacts are just cervical to the junction of the occlusal and middle thirds. From the lingual view, the lingual cusp is slightly offset to the mesial. From the proximal view, height of contour on the buccal is in the cervical third near the junction with the middle third. On the lingual, it's in the middle third. There's no mesial marginal groove. From the occlusal, the outline is more rounded than the first premolar. There's a short central groove, convergence towards the lingual, a buccal ridge. There are more supplemental grooves, giving the appearance of the occlusal a more wrinkled look. The maxillary first molar is the largest tooth in the arch. It's also the largest crown in the dentition. There are 4 major cusps and a 5th minor cusp. And the frication area starts near the junction of the cervical and middle thirds of the root. From the facial view, there's a buccal groove, which may end in a buccal pit. The mesial contact is at the junction of the middle and occlusal thirds. The distal contact is in the middle third. The mesial buccal cusp is wider than the mesiolingual cusp. And the mesial outline is flat from the CEJ to the contact, and the distal outline is convex from the CEJ to the occlusal. From the lingual view, the mesiolingual cusp is the largest and highest cusp on the tooth, and you can also see the fifth minor cusp, the cusp of Chiarabelli. From the proximal view, the crown is shorter in height occlusal cervically and more broad in the facial lingual direction. The buccal height of contour is in the cervical third. The lingual height of contour is in the middle third. From the occlusal view, the mesiolingual cusp has two triangular ridges, one which crosses to the mesiobuccal, forming a transverse ridge, and another which crosses to the distal buccal, forming an oblique ridge. The mesial contact is slightly buccal to center. The distal contact is centered buccolingually. There are 4 fossa, and 3 pits, central pit, mesial pit, and distal pit. There's also a transverse groove which crosses over the oblique ridge. The maxillary second molar is essentially a smaller version of the maxillary first molar. The main difference is the size of the distal lingual cusp varies, or it may not be there at all, in which case the occlusal profile will look more heart-shaped. From the facial, the mesiobuccal cusp is longer and wider than the distal buccal cusp. There's a buccal groove, but it's shorter than the one on the first molar. The mesial and distal contacts are both in the middle third. From the lingual view, the mesiolingual cusp is the largest cusp. There is a lingual groove when there is both a mesiolingual and distal lingual cusp present, and there's usually no cusp of Chiarabelli. From the proximal view, the buccal height of contour is in the cervical third, and the lingual height of contour is in the middle third. The mesial contact area is larger than the contact area on the first molar. From the occlusal view, there will be a taper toward the lingual if there is no distal lingual cusp. If there is a distal lingual cusp, it'll be smaller. There's also a smaller oblique ridge than the first molars. The mesial contact is slightly buccal to center, and if there is a distal contact, it's closer to centered. The mandibular central incisor tends to be fairly symmetrical. It is one of the smallest and simplest tooth in the mouth. There's an incisal edge and incisal angles. Distinguishing the right from the left, the mesial incisal angle is a little bit sharper, while the distal incisal angle is a little rounder. The mesial contact is in the incisal third. The distal contact is also in the incisal third. From the lingual, the anatomy tends to be fairly simple. There is a small cingulum. There are also mesial and distal marginal ridges, but they tend to be a little bit subtle. There also is a lingual fossa, and it also is subtle. Looking at it from the proximal view, the heights of contour on both the buccal and the lingual are in the cervical third. And from the incisal, the outline is fairly symmetrical. There's an incisal edge which is just lingual to the long axis of the tooth, and the incisal edge tends to be fairly straight. The mandibular lateral incisor has imbrication lines. There's also an incisal edge. And once again, the mesial incisal is sharper than the distal incisal. The mesial and distal contacts are in the incisal 1/3. The lateral is very similar to the central, but it is not as symmetrical. The lingual view has a small cingulum placed a little bit more distally. There's a lingual fossa. And the mesial marginal ridge is longer than the distal marginal ridge. From the proximal, you can see that the tooth has a twist towards the distal. That twist is visible on the distal view. On the mesial view, the tooth looks more straight. Also, from the incisal view, you can see that on the distal, on the left-hand side, there's a slight twist. The mandibular canine has a single cusp tip and cusp slopes. The mesial cusp slope is shorter than the distal cusp slope. There's a slight labial ridge. Canines are the longest teeth in the dentition. The mesial contact is in the incisal third. The distal contact is at the junction of the middle and incisal third. The distal outline is both shorter and rounder than the mesial outline, which is more straight. The lingual anatomy is fairly smooth. There are mesial and distal marginal ridges, and there is a lingual fossa, and a very slight lingual ridge. From the proximal, we have the mesial and distal views. The tooth has a triangular outline when viewed from the proximal. The heights of contour for both labial and lingual are in the cervical third. And the CEJ curves up more on the mesial than on the distal. On the incisal view, the crown is wider in the labial-lingual direction than in the mesial-distal direction. The crown is offset a bit to the mesial, which is on the right, and the cingulum offset to the distal, which gives a slight asymmetrical appearance. Mandibular premolars are usually single-rooted. The first mandibular premolar is usually a little smaller than the second premolar. The mandibular first premolar has a long, pointed buccal cusp and a lingual cusp that's not functional. From the buccal cusp is slightly mesial to center, and therefore the mesial cusp slope is shorter than the distal cusp slope. Mesial and distal contacts are just cervical to the junction of the occlusal and middle thirds. The mesial outline is slightly concave, and the distal outline is rounder. From the lingual view, there's a mesial-lingual groove between the lingual cusp and the mesial marginal ridge. There's also a small lingual cusp in comparison with the buccal cusp. From the proximal, we can see that there's a lingual inclination of the crown. And because of this, the buccal cusp tip is near the long axis of the tooth. The mesial marginal ridge slopes towards the lingual. The buccal height of contour is in the cervical third. The lingual height of contour is in the middle third. From the occlusal, there's a proximate diamond-shaped outline. The buccal triangular ridge is longer than the lingual triangular ridge. The mesial marginal ridge is shorter and less prominent than the distal marginal ridge. The mesial and distal converge towards the lingual, and there are mesial and distal pits and fossa. The mandibular second premolar can be either a three-cusp type, which would have a buccal cusp and two small lingual cusps, or a two-cusp type. The buccal has a shorter, more rounded buccal cusp than the first premolar. The mesial and distal contacts are located just below the junction of the occlusal and the middle thirds. The lingual cusp is a little smaller than the buccal cusp, but larger than the one found on the first premolar. In the three-cusp variation, there is a lingual groove separating the mesiolingual and distal lingual cusps. From the proximal view, the mesial marginal ridge is 90 degrees to the long axis of the tooth. This tooth is wider in the buccal lingual direction than the first premolar. This is showing the three-cusp type. There is a V-shaped central groove which connects to the lingual groove to create a Y-shaped groove pattern. The central pit is at the junction of the central and lingual groove, and there's often a mesial marginal groove or spillway, as well as mesial and distal pits. The mandibular right molars. Note that there's a general slope downwards towards the distal, and that the roots incline towards the distal. On the labial view, there are three cusps, the mesial buccal, the distal buccal, and the distal. There are two grooves, the distal buccal groove and the mesiobuccal groove, which ends often in a pit. The heights of contour on the proximal surfaces are at the junction of the occlusal and middle thirds on both the mesial and the distal. From the contact to the CEJ, the mesial outline is fairly straight, while the distal outline is more convex or bulbous due to the distal cusp. From the lingual view, you can see the large mesiolingual cusp, a slight lingual groove, and again you can see the bulge of the distal cusp from the lingual. From the mesial view, the buccal height of contour is in the cervical third, the lingual height of contour in the middle third. There's a mesial marginal ridge with a little spillway. From the distal view, you can see that tall mesiolingual cusp peeking from behind. You can also see the distal cusp and the distal buccal groove. Again, the heights of contour on the buccal and the lingual, and the distal marginal ridge. From the occlusal view, the labial outline, the buccal ridge, the mesiobuccal groove, the distal buccal groove. This is the central groove. The groove makes a Y-shaped pattern. This is the lingual groove, mesiobuccal groove, distal buccal groove. There's a mesial triangular fossa and a distal triangular fossa. The distal marginal ridge, the mesial marginal ridge, triangular ridges on all 5 cusps, a central pit, note the convergence towards the distal. That is, the tooth is wider on the mesial than on the distal. The buccal view of the mandibular second molar, the contact areas are in the middle third. There's a more bulbous mesial outline than on the distal side. There's a buccal groove. From the lingual, note the mesiolingual cusp is taller, and again the mesial and distal outlines. Looking from the mesial view, the height of contour on the buccal is in the cervical third. On the lingual, it's in the middle third. There's a mesial marginal ridge. From the distal view, we have the distal marginal ridge, and again the heights of contour on the buccal and on the lingual. From the occlusal view, you can see the convergence from the mesial to the distal. That is, the tooth is wider labiolingually on the mesial than it is on the distal. The groove pattern is a plus sign or a hot cross bun. This is the central groove. And then there's a groove running from buccal to lingual. This is the lingual part of the groove, the buccal part of the groove, the central pit. There's a distal triangular fossa, a mesial triangular fossa, the mesial marginal ridge, the distal marginal ridge, the contact area on the mesial, the contact area on the distal.
It all starts at the primitive mouth of a 5-week-old embryo. At the location of the future dental arches, the epithelium of the primitive mouth is called odontogenic epithelium. Under this odontogenic epithelium, the mesenchyme is turned into ectomesenchyme, arising from neural crest cells. The odontogenic epithelium then sends induction messages that convert the neural crest cells into odontogenic cells. Then, by shift of the mitotic spindles of the basal cells, The odontogenic epithelium proliferates and then becomes invaginated, forming a U-shaped band known as the primitive epithelial band. This primitive band bifurcates into a primary dental lamina on the inside and a vestibular lamina, which will eventually form the vestibular mucosa on the outside. It is on this dental lamina that the teeth will form. For this to happen, dental placodes will appear, inducing the formation of dental buds. The ectomesenchyme then sends signals that trigger localized cell proliferation. The bud thus turns into a dental cap. This cap is formed around the dental papilla. It is surrounded and protected by the dental follicule. The germ of each deciduous tooth is thus formed with a certain time lag. After this, we reach the Bell stage. The tooth germ increases in volume and expands while creating the future enamel-dentin junction. Finally, the coronal dentin and enamel of the tooth are progressively formed along the cusp slopes.